Hello, hi, it's Dr. Erica, pharmacist, owner, and founder of Millennium Pharmacy here in Alabama. I am the um, pharmacist for this particular uh, video channel, and I upload contents every week, mainly daily currently. And I invite you to join me on not only this particular video, but other videos in this series called Eye, Ears, Nose, and Throat. I've dedicated that particular playlist for infections, for conjunctivitis, glaucoma, as well, mucus, dealing with, again, the eye, ear, nose, and throat. Okay, so on this particular video, I'm going to talk about um, ear infection, also known as otitis media. Otitis media is very prevalent in infants, toddlers, pediatric patients, as well as adolescents and adults. Now, in this particular video, I'm going to talk about the different types, the more complex, the simple, and then the medications that are used for treatment. Okay, so stay tuned to the end of the video, like, share, and also subscribe. Now, fever is a part of the side effect or symptoms for otitis media. Having high temperature is indicative of complex bacterial infection, possibly fluid on the eardrum or inner middle part of the ear, and so will be a opportunity to receive more medications that are high dose, medications that are more broad spectrum, that are more effective against those penicillin suspicious resistant bacteria. And also there's coverage for patients who have a true known allergy to these medications, such as amoxil. Now, those who have a true allergy or IgE immunoglobulin response to amoxicillin can receive other medication classes to help with treatment instead. There are non-pharmacological treatments that are available, and I'll go over some of those as well. And then there's also, again, the pharmacological. Now, also are over-the-counter pain medications that can be used for oral treatments, such as Tylenol or acetaminophen for the pain that these little individuals may be experiencing. Also, we'll have opportunity to introduce ibuprofen for this particular situation to help with inflammation and to help with reducing the amount of tugging on the ear, which is indicative of infection as well. Also, there are topical ear drops that can be inserted into the ear, such as lidocaine and benzocaine, active ingredients that are known to numb and prevent pain. And then also there are medications such as hydrogen peroxide that helps to reduce the amount of wax in the ear. Also a product called Debrox that is on the market with helping to clean out the ear on a regular basis, keeping infection out of the ear. Using a cotton swab after use of the Debrox can also warrant a chance to reduce opportunity for infection. Now, there has been a, um, a correlation with vaccinations and reductions in ear infection, such as vaccinations against the influenza virus, the seasonal influenza virus, also vaccination against pneumonia virus that causes upper respiratory tract infections, such as the otitis media, other laryngitis, and so forth. So it's best to be vaccinated early on in childhood against these particular viruses, such as the influenza and pneumonia vaccine as well. to encourage those vaccines to help reduce the number of infections and the occurrence as a prophylaxis measure. Now, amoxicillin, as far as treatment, is going to be for simple otitis media with relief of symptoms within 2 to 3 days. Patients will begin to feel better. Patients will begin to have less pain. Patients will begin to feel less swelling in the ear as well. And it's for acute otitis media. Okay. Now, amoxicillin is very economical as far as pricing. It has a narrow spectrum of bacterial coverage. It's very specific. It's very safe. It has a long history of safety, and it's beneficial against resistant, or is very beneficial, but not so much against certain bacteria, such as the influenza, Haemophilus influenzae, and also the other bacteria that are known to cause this particular infection. So I do want to make note of that. Patients who are allergic to amoxicillin can be treated with a second or third generation cephalosporin instead. Now, also, there are medications that can be utilized for patients who do have a true allergy, and that's going to be your clindamycin, that's going to be your azithromycin as well. All of those are available. Clarithromycin, also known as Biaxin, and then also the azithromycin can be used in patients who have a true known allergy, such as hives development, swelling of the throat, anaphylaxis reaction, swelling of the tongue, so that breathing is not allowed. So those are true allergic symptoms. In those particular cases, again, we want to try the azithromycin as well as the clarithromycin. Now, in cases where the otitis media is very serious, moderate to severe, meaning that there's fluid in the eardrum, there is infection behind the eardrum, there's discoloration of the eardrum, we want to initiate the clindamycin or cliocin, as well as the second and third generation cephalosporins to help reduce symptoms within a few days or so. Now, serious, moderate to severe, serious otitis media, again, is going to be a temperature, a fever. It could also be patients who have not recovered within 2 days after beginning antibiotic therapy. Those are the more serious infections, so we're going to treat with more serious medications such as the cliocin, second, third generation cephalosporin, and also high dose, or not even high dose amoxicillin. Not even high dose amoxicillin. Amoxicillin, again, high dose is good for patients who in patients where we suspect a penicillin-resistant bacteria only. Okay. Now, cliocin is dosed maybe 3 times a day for treatment. It may cause a change in taste perception, and also may cause some GI upset as well as diarrhea. So do be aware of that. It is a medication that works by changing the protein, or blocking the protein of the bacteria. Once that is blocked, the bacteria can no longer function, and so we get bactericidal effects. Okay. Also, it's best to use cliocin with plenty of water, 8 ounces of water per dosing, with no food if possible, for increased absorption and bioavailability through the GI absorption process. Now, the second and third generation cephalosporins are good medications when there is an allergic, not a true allergic reaction, but a sensitivity or hypersensitivity to penicillin and amoxicillin. Then we want to go with our second and third generation cephalosporins, for example, cefprozil, omnicef, ceftriaxone. Those are the second and third generation ones that we recommend. Also, ceftriaxone is also a cephalosporin that will be beneficial in very severe cases where there's fever, where there's no symptom relief after about 2 to 3 days. Then we want to get into the fourth generation. We want to get a little bit higher in the cephalosporins. Cephalosporins are like the cousins to the penicillins and amoxicillins. The cephalosporins are very peculiar. They're very different, but they also are very effective. There's a hypersensitivity to those. Let your doctor know that so that they can make adjustments appropriately. Now, cephalosporins are dosed usually twice a day for a total of about 7 days for otitis media. Again, medications that are used for otitis media are used to or dosed again up to 7 days. Okay, whereas with the other infection that I mentioned, the infection of the sinusitis, we're going to treat 10 days to 14 days. With otitis media, we're going to treat for 7 days, typically. Research has found that 7-day dosing is long enough to where the medication will reduce symptoms and eradication of the bacteria. Okay, so now the cephalosporins, third generation and second generation, can be used for those patients who have had a recurrent infection and no relief, those patients who have a non-serious allergic reaction. Also can be used in patients, again, who have fever with otitis media. The fever is indicative of fluid behind the eardrum or in the middle part of the ear. Now, those particular ones, those fourth generations, third generation cephalosporins can get back into that area to work, but usually cephalosporins do not have that capability. So we're going to go with usually a clindamycin at that point. The class of fluoroquinolones, I'll go over fluoroquinolones briefly, but cephalosporins, again, usually do not have the capability of penetrating through to the middle ear portion because of the complex the complex in pharmacodynamics is what we call it. It does not get to that particular, those medications do not get to that particular point of location. So we want to go with something stronger, such as clindamycin. Also, the fluoroquinolones are good as well. They do have a side effect profile that is contraindicated for pediatric patients, which gives it a box warning currently, based upon its known side effect profile of muscle tenderness, ligament rupture, lesions of the ligaments as well in research trials. And also we want to prevent that in our pediatric patients. So levaquin or levofloxacin, moxifloxacin, those particular ones are very, very much reserved for serious cases, for cases that we want to use other better beneficial medications. So again, levofloxacin or levaquin is not indicative for use in pediatric patients because of, again, the side effects box warning. And so we want to choose other medications. However, that medication is very effective and it also penetrates to the middle part of the ear to treat the infection and eradicate symptoms. Now, doxycycline or vibramycin is not indicative of this particular treatment for this particular disease state. It is bacterial site or static, which means that it doesn't kill the bacteria. It only lessens the concentration, halting the growth of the bacteria. So in this particular situation, we do want to eradicate and reduce symptoms completely. So I've gone over medications for treatment, and if there's any comments or questions, please let me know. Otitis media is prevalent again in our pediatric populations. Just because of these particular infants and toddlers are suckling milk from lactating mothers. They're also receiving milk products through formulations, and when they're positioned to receive their meals, these infants, they experience fluid rushing from the back of the throat to the inner ear, causing infection. So that's why we see otitis media more prevalent in our infants and our babies, for the known fact that milk consumption, when we lay our child down to consume milk, that fluid from the milk rushes down to can rush down back into the ears, causing otitis media. So it's very much recommended to prevent that by sitting the child up in an upright position and feeding the child through bottle or through breast milk in an upright, maybe a 45-degree angle or a 90-degree angle when feeding, instead of actually laying the child down or reclining the child. So that is just a healthy tidbit that I've come to learn over the years, and as a pharmacist, as a healthcare provider. So do be on the aware of, if you have any young people that this particular disease state is very prevalent, and we want to avoid as well by vaccinations, pneumonia vaccine, influenza vaccine at early age. They are, these particular pediatric patients are eligible for the vaccine, and it's known that these vaccines have reduced the occurrence of otitis media, okay? So do be aware of that. Again, I'm Dr. Erica. Thank you for joining me on this particular video. I hope to see you on the next video. Thank you for joining me. Like, share, and subscribe. Have a great day.